Okay, Jill Ludford, Chief Executive of the Murrumbidgee Local Health District.
Yep, all good.
Okay, good morning. I'm here to provide an update on the COVID-19 pandemic across the Murrumbidgee region. So at the moment, the Murrumbidgee Local Health District is partnering with other healthcare providers in the Victorian border region, and we're managing a significant outbreak in the communities on both sides of the Murray River in Albury and also Wodonga. It's really important that we see this outbreak as one outbreak, not just the bit on the Albury side, and we are having joint planning meetings with members of the Victorian Government and Albury Wodonga Health who are working in partnership with us. So we are working really hard to have that contact tracing done quickly, get people into isolation, and we're looking now at having 261 active cases in that community. The clinical care is provided by Albury Wodonga Health in that region, and the Murrumbidgee Local Health District is responsible for the public health response. But I think more importantly now, we're also starting to see some seeding from this outbreak coming into the LGAs around the border region. And so my message to people is this is a very, very important time. We have to be vigilant. We've stopped talking about social distancing and washing your hands, but actually those are the two most critical things that you can do to help keep yourself safe during a time like this. And of course, mask wearing. Mask wearing will significantly reduce the risk of transmission. So if you're out and about in the community, I strongly recommend that people still continue to wear their mask, particularly if you're in a venue where there's a large number of people. For example, in our office here, even though we don't need to, under the current health directions, wear masks, we are all wearing masks as that additional level of protection. And of course, vaccination is really, really important. It is our ticket to really slow transmission and for us to resume our normal freedoms. So I'm going to give you the case breakdowns now. So we are reporting to 8 p.m. last night, 46 cases today. But I do want to say that yesterday we had 37 cases, and on Sunday we had 47 cases. So we have been incredibly lucky in the Murrumbidgee region to date, where we've had one or two isolated exposures, isolated cases. The difference now is that we are seeing community transmission, and that is a very big difference. So for the cases reported today, 41 are in Albury, 1 in the Coolaman LGA, but I just want to say that the case reported in Coolaman today and yesterday, those cases are not residing in the region, in the LGA, and they're outside of the Murrumbidgee Local Health District region in isolation and being cared for. There's a case in the Federation LGA, 1 in Greater Hume, 1 in Berrigan, and 1 now in the Murrumbidgee region. So you can see that seeding from around the Albury outbreak. Of the cases today, 20 of them are linked, 10 are close contacts, and 10 are household contacts, and we've got 26 that are currently under investigation. New South Wales Health is providing us with additional support. We've got a senior public health official who has joined us here in our public health team, and we have a number of contact tracers who are now working to help us do that fast interview with new cases so that we can get the details and get those close contacts into isolation as well. So over the weekend, we saw an additional 130 cases in our region. There was also a death reported on Saturday, an aged care resident who sadly passed away in Albury last week, and our condolences go out to his family and friends and all the people in the Albury region. That case was actually reported by the facility earlier in the week, and I just want to reiterate that now just brings 2 people who've passed away in that residential aged care facility. And of course, our elderly residents are the most vulnerable in our community, and we're working really closely with residential aged care facilities in the Albury region, in particular where we have the outbreak, and there is a fantastic spirit of collaboration with Commonwealth representatives assisting. Additional workforce has been provided, and Albury-Wodonga Health providing clinical care, and we're providing expertise in infection control. So it's great to see that protection being added to our most vulnerable population areas. In that facility, all of the infected residents are isolated in one pod, and I'm really confident in the way that that facility is managing their outbreak. Schools are also a great concern. Now we have such a great number of people who are vaccinated in our region. The most, again, we've got two extremes, bookends, are those children under 12 who aren't able currently to be vaccinated. And in the schools, we have seen quite a number of primary school age children who have had positive cases and have been transmission sources. So we're working really closely with the Department of Education. It's very difficult for parents when they have a letter from their school and schools are made non-operational, where we have families who are in isolation and taking parents out of employment and work. So working really closely with the Department of Education and Health together to strengthen the message, to ensure that we can get at least one parent back at work and make sure that we can minimise that isolation time for families and the impact on communities. What we're really asking for children, and this is really for people under the age of 16, during this time where it is risky, really have a look at extracurricular activities, particularly indoor sport, bowling, indoor, things like dancing, clubs. It's probably best if those sorts of activities can be held outdoors with people wearing masks, and really limit our movements and activities to try and break some of the chains of transmission. During this time, we're going to have a big focus on vaccinating our 12 to 15-year-old age group, and working now closely with Albury-Wodonga Health to have a Super Kids Week this week. We're currently in Albury today vaccinating some of the vulnerable population areas, but for the rest of the week, encourage parents to keep your eye on our website. We'll be at the exhibition centre over the next 2 days, Tuesday and Wednesday, and it's a great time to bring your children down and get them vaccinated during this time where we've got quite a lot of community transmission. Only 24% of children are currently vaccinated in the Albury local health, in the Albury LGA. So we can really do better than that. Let's make Albury the most vaccinated LGA for children and keep them all safe. So last week we completed 2,515 vaccines across our region, and we're starting to see now with 93.1% of our people already having their first dose, and we're climbing up. We're so close to 80% now. We're really looking now at going to people who are unable to come to some of those static clinics. So we've been doing pop-up clinics all over the region. I'm going to talk about testing, and then I'll hand over to Tony Burns, who's going to talk a little bit about the Sewage Surveillance program. But I just want to thank the communities. We have had the most incredible response to testing that we have ever seen in our region. It has been an absolutely wonderful blitz. We have completed 17,374 tests in the last 7 days. That is double what we did the preceding period. So rural people, country people are always happy to help and help to keep their communities safe. And I want to thank each and every community for really coming forward and being tested. Getting people tested, and if they're positive, into isolation early is the way that, together with vaccination, we can slow transmission of COVID in our region. So with that, I'm going to hand over now to Mr. Tony Burns to talk about sewage surveillance testing. Thank you, Mr. Burns.
Good morning, thanks Jill. Look, I'm just going to touch on the sewage surveillance program that is running across New South Wales and in the Murrumbidgee Local Health District as well. We have nearly every major town across the LGAs in the Murrumbidgee that is doing, at least as a minimum, weekly sewage surveillance. Yes, we have seen a number of detections across the district, and I think that goes to what Jill has just mentioned about the number of cases that have started to appear. So we are picking that up very early in the sewage system. And as I said, we then work with local councils to ensure that they increase additional testing so that we can get a good, clear picture as to what might be happening in a local government area. So the sewage surveillance program is working really well. We are getting the notifications. We are picking up where we are getting detections in an area, and then we work with the rest of the LHD team to either pop up additional testing in the town to give us that clearer understanding and a bit of satisfaction to know that we are jumping onto the potential for cases at an early stage. So at the moment we're really keen to ensure that the councils continue this work, and they're working really well with MLHD in this area at the moment. I might leave it at that and come back for any questions.
Yes, thank you.
Thanks,
and
Jill.
I might hand over to our police colleague. Thank you. Thanks, Winston.
Yeah, good afternoon. I won't really have anything to report, but I'll take some questions at this time and will point me in the right direction if you like.
How is COVID compliance looking at the moment in the community?
Look, it was a good weekend for us. We only had one incident in a licensed premises that caused us any trouble. However, what is filtering in is some businesses, licensed premises, aren't asking people if they're double vaccinated. So that's a bit of an issue to us if businesses where we do see a large number of people congregating, and possibly where this virus would spread the most in a licensed premises when we get a bit lapse. I'm asking everybody, and I think that Jill hits the nail on the head, where you've got to keep your community safe. I can't emphasise the importance of how quickly we could be in a position where police are conducting multiple checks on positive people in the Riverina Police District. So I'm just asking that businesses remain vigilant. We're still subject to the public health order, so we will enforce that, but we will also be out and about just to make sure that people are doing the right thing. I don't really want to have to start enforcing writing $5,000 tickets to the owners of these businesses for not doing the right thing. I just ask that we remain vigilant, keep doing what we're doing, but over the weekend I thank everybody for a safe weekend we've seen across the district.
Have there been any businesses that have copped those fines for not asking people?
Not yet, but we're looking at 2.
Just as everyone starts to move around a bit more as well, do you have any plans for increased presence on the roads and just monitoring that safety in that respect?
Yeah, well, I heard this morning that as of 6 p.m. on Friday, Melbourne will be released to come out to the regional areas. So that's Wodonga, as we know, and as you've heard, there's already an outbreak down there in the Albury-Wodonga region. A lot of people travel from here down to the border and across. You know, they like to visit those small regional towns in Victoria. So I can only say that remain safe. We will be out and about. All of our cars, all of the RBT and the drug testing that we do, we are remaining vigilant. But it's becoming hard now at the moment because we're opening up.
Yeah, so how will compliance look different when people from Melbourne are allowed to the regions and also people from Sydney and those areas are allowed back from Monday? Is it going to be a bit different from then?
Well, I think we're opening up. We have to learn to evolve policing-wise to make sure that the places that those people are visiting are doing the right thing. I don't think it's true that they will be coming, but it's where they come to and it's the businesses they attend that we have to pay attention to. And I'm just asking everybody who owns a business or is in that tourism industry that yes, we've been locked down for a long time, but please remain vigilant. Please use the QR coding and also check the double vaccination for the time being. I'm not sure how long the double vaccination checking will go for, but we need to remain vigilant and we will enforce that because that's the public health order at the moment.
So how do police monitor for vaccine status, or are you mainly focused on going to businesses and checking that they are
checking people?
We've shifted a lot from enforcement to education. I'd rather go to a business and say, look, do you know how to do this, or are you sure, or are you checking people? We, like the Commissioner said a lot of times, it's something that we've never responded to before. So police are doing their job in relation to the public health order, but I like to see it also as that education part of it, where we go to businesses, our school liaison officers speak to schools, you know, we get into the community and we provide some advice and guidance from our perspective, the best way of doing it.
You said it was a pretty slow weekend. Were there any specific incidences during the last week that stood out in terms of COVID compliance?
No, not really. Not really. I think everyone's doing the best they can. I honestly do. Like I've said to you before, I don't expect businesses to get involved in a heated argument or a violent confrontation with anybody who's not going to produce their double vaccination or their scan in with the QR code. Just give us a call and we'll come down and look after that.
Do you think that might be why some of them aren't asking at all? They're just a bit scared of what might happen?
Well, just from my own personal perspective, I was out and about on the weekend, and I can honestly say, like in plain clothes, heaps of business. Everybody I walked into was very vigilant about asking, so I applaud them for that, so that's a good thing.
I've got
Thanks.
some questions for Jill.
Thanks very much.
Thanks, Winston. I've just got a few from Aubrey that I'll jump into first. So obviously there was quite a testing boom down there recently with all the cases coming up. How has the MLHD been managing that with limited resources some of the time and just a sudden boom?
So the testing, as you say, is one of the most critical steps when you're managing an outbreak. So we've been working with our partners, and when we say partners, we actually mean the private pathology providers who have been absolutely wonderful in opening up new drive-throughs. There's one at the Lavity Sports Ground, extending their hours, and of course Albury-Wodonga Health, who have also got mobile teams out and about in the communities. I think the thing that we've really looked at recently has been home testing. We have to understand there are a number of people who may not be able to travel if they're unwell or if they don't have access to transport. So over the weekend we had a presence down in Albury doing some testing in the Riverina community centre, really focusing people who are from those non-English speaking backgrounds. We've got 3 interpreters on the ground down there working alongside us, and we've been into households and tested quite a large number of people along with an interpreter in a safe environment where people are going to feel comfortable. Those teams are also able to vaccinate, and I think we need to, during an outbreak like this, really look after people, their whole needs. So there was also clinical teams available if people were symptomatic and hadn't been diagnosed. So taking testing into homes has been a really critical step in terms of managing the pandemic and looking after some of our non-English speaking backgrounds with interpreters.
Sure. And do you expect those cases to plateau anytime soon, or obviously we're opening up a little bit more so it might go up still?
Yes, and look, there's community transmission at the moment, and the growth factor down in the Albury-Wodonga region is over 1. So realistically speaking, we will continue to see the case numbers there rising over the next few days as we get on top of the outbreak and get people into isolation, get more people vaccinated, and then we'll start to see a slowdown. And we've seen that in other communities in Sydney where the numbers peak and then will start to come down again.
How would you say overall, I suppose, you've been managing the outbreak down there?
And look, there are a large number of people who are unwell and receiving care from Albury-Wodonga Health in their care in the home model. Also really important is that there are a very low number of people who are currently in hospital. There's only 2 people in hospital currently with such a large outbreak. That's a result of people having that high level of vaccination where, whilst they're getting sick, they're not getting really seriously unwell where they need to be hospitalised. So that's a good sign and a good signal, and very different to some of the results that we saw earlier in the pandemic with large numbers of people impacting on the health services.
Can you tell us any more details about the Wagga case?
So not at this stage. The Wagga case was only reported at 8 p.m. last night, so currently we're doing some investigations there. It is thought at this stage that it is linked with the outbreak in Albury.
As in they might have travelled to Albury or someone from Albury's come here?
Just linked at this point in time, yeah.
And in terms of those exposure sites, do we know any at the moment that you can confirm, or is it just a matter of people checking their Service New South Wales?
Yes, and for communities and people, there's a transition now in the New South Wales government away from our local contact tracers looking after venues of concern. When they do the interview now, all the information goes into the system, and that automatically goes into the venue tracker. So that's sort of a much quicker and more efficient way of getting those venues of concern up there and available for people to have a look at. I think there's still a bit more work to do around the linkages with the Service New South Wales app, because that actually shows you all of the venues that you've been into rather than the venues of concern. So certainly our Director of Public Health will be able to provide more information tomorrow at the press conference around the transition as we go through into the venue tracking. It is a bit of a transition, and there's probably a few loose bits around the edges that we still need to probably iron out before we get it all working smoothly.
Would you recommend that people do actively check their history then?
Yeah, absolutely. And I think probably the most important point is that if you do check your phone or your device, jump onto the New South Wales Venue Tracker website, because those venues that are listed there are the venues where we are seeking people to come forward and get tested and go into isolation until they receive their test results. They're the ones that we really want people to be having a look at.
So if it's just come up red on their history, they only need to get tested if they have symptoms?
If it comes up red on your history, go into the New South Wales Venue Tracker and it will tell you exactly what to do.
Do you have any specific figures on Wagga vaccination rates? I know you sort of said Murrumbidgee as a whole, but how's Wagga doing?
I haven't got the Wagga vaccination rates yet because they come out actually on a Monday afternoon, so I reported them last week. But there is a really fantastic Living with COVID app on the New South Wales Government website that you can now just click on LGA and you can get those results, and they're updated each week. Yep.
Do you have Junie's going as well with that push that they had to boost vaccination numbers there?
Junie's vaccination rates are going up very well. It's been wonderful to see, and I think their issues were really to do with supply of vaccine, and once the supply came through to their medical staff, we did that acceleration clinic there, and to their pharmacists we saw a really fantastic acceleration of their rates, and the willingness of the people to come forward and get vaccinated has been fantastic.
Do we know anything more about how the outbreak in Albury began?
And look, when we're talking about the outbreak in Albury, we really should be talking Albury-Wodonga because it is really one community with that big creek that runs down the middle. And look, at this point in time, it's very difficult to say where the original source case came from. So we haven't done genomic testing, so I really can't comment on where the case came from. But, you know, now that we have people moving around more freely across our different states, and of course that collision of the border there where we've got people moving cross-border, I think it's pretty easy to see that we're going to see this sort of transmission happening more and more.
Some good news as well with the Tumour Hospital. What can you tell us about the services there now?
Oh, look, there's a wonderful news for the residents of Tumut. I had a look in the new hospital just a couple of days ago, and it is absolutely superb. Same architects actually as the Wagga Stage 3. Beautiful high-end finishes and new services to be offered to the community there as they start their operational commissioning, as we call it. That's just code for moving in over the coming days. Yep.
With the case in Wagga, you said it's possibly linked to Albury, but given the sewage testing results and the new exposure sites, does the health district have any fears there could be, undetected community transmission in the community?
Yes, and undetected community transmission is the very thing that we are concerned about, absolutely. And, you know, in young people in particular, who might have been out and about and they're more sociable perhaps than people in my age bracket. And so very important that we do make that testing really easy for people to access, because we won't know about it until we start seeing people get sick unless they come forward for testing.
Just with the outbreak, we have suggested that some areas limit their travel, but with travel resuming from Sydney and Melbourne and those sort of areas, are we worried that that will see the outbreak grow and spread further into surrounding areas?
Well, I think that the lifting of the travel in both of the states has been prefaced on rates of vaccination. So I guess what we are saying is we can't live in lockdown forever, and we need to be able to resume more of our normal business and activities for all the reasons of mental health and well-being, as well as for economic and business reasons. And we're coming up to the Christmas period now, and it's summertime where you have lower rates of transmission in the summer months. So if people are vaccinated and they follow the public health precautions, washing their hands, social distancing, wearing masks, that's our way of getting a semblance of normality back into our lives again. Okay, thank you very much.
For Tony, if that's all right.
Okay.
Well, you stay up.
So on the New South Wales Health page for sewage surveillance, they've listed traces found in Wagga, Coringal and Narong catchments, but on the New South Wales Health updates, they've just mentioned Coringal as an area of concern. Do you know why that might be?
Look, the issues around the regular testing that the council are doing, Wagga and Narong is the one treatment plan. We have two treatment plans here in Wagga. Narong is down the northern end of Wagga, and the other one is the Coringal sewage treatment plant. So, excuse me, based around the testing that they were doing, they've done additional testing at the Coringal plant on a particular week, and that has picked up a detection there that we hadn't seen in Narong earlier in the week. So it's really just around the surveillance program and the frequency of testing that is happening at a local level.
Mm-hmm. And so what's council's role in these sewage detection, how that works?
Look, the council run the sewage treatment facility for the local government area. We work closely with the council. They're again one of our partners in this whole process. They facilitate the whole process with us. They get their operators to take the sample, they package it up and get it off to the lab in Sydney, where Sydney Water Lab are the ones who do the analysis for New South Wales Health and for the state. So the councils are the ones who are at a local level taking that sample and getting it ready and sending it off for testing.
Mm-hmm. And so how often is Wagga sewage tested?
At the moment, because we have had a couple of detections, they're tested twice weekly. So both plants are tested twice weekly here in town.
Mm-hmm. And so it's been said in the past there's been positive sewage due to people in hospital with COVID. Does waste from a COVID patient in hospital end up in all of the catchments or just one of the two?
No, it ends up in the Narong treatment plant because it comes from this side of town, whereas the Coringal plant treats the sewage from Coringal, Lake Albert and that Springdale area.
Mm-hmm.
So,
and so the way the testing works, you said it's collected and sent away to
yes,
be tested?
That's right.
Mm-hmm.
We have separate samples come from both plants, so they are able to analyse those separately. That's how we know it's come from a particular part of the system.
So it's safe to say that that Coringal testing hasn't come from the hospital
Correct.
patients?
Correct.
Do you have any idea what that might be? Undetected cases in the community?
Look, it could be. You remember back there was a young girl in Wagga a couple of weeks ago that had was a confirmed case. That I'm not sure exactly how long we excrete the virus out of our system, but you know she's now well, and I think that person was living in that part of the catchment. But that's why it's always important to reinforce what Jill has said. You know, in any way, if you are unwell, always come forward to testing. This surveillance program is an early detection for us to potentially pick up where we don't have cases confirmed, but we may have the virus being shed and ending up in the system.
So do we have any detections at the moment in areas that don't have any cases?
No, everything that's been reported to date is where we have known cases. I mean, in the Murrumbidgee LHD, we have had detections reported in a couple of towns. Leeton's as an example. Leeton's now gone to twice weekly sampling to try and pick up to see whether there is anything happening there. Look, we have had it in some of those areas like Hay, West Wyalong. We do get a lot of transport workers and the others who transit through those towns. It's always hard to know whether you've got someone in the town or if it's someone that has visited and transited through. That's why it's important for us to ensure the whole process of people coming forward for testing, our surveillance program, they all work together.
Okay.
Well, good, thank
Thank
you.
you very much.